You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. With us, we have an expert on the topic. He's been on the program before, and he says nobody should be wearing a loose-fitting denture. With us, we have board-certified oral surgeon, Dr. Michael Pikos. Dr. Pikos, welcome to the program.
Hi, Randy. Great to be back again.
Now, for people that don't know your practice, I guess you're one of the few oral surgeons that all you do is focus on dental implant dentistry. Is that correct? So who's the typical patient that comes in for what you do?
Well, you're right. I really wanted to focus in one arena, and I did this about 22 years ago. So the 34 years I'm in practice, although I did implants from day one, I pretty much focused in this one area over the last 22 years. So I don't take out wisdom teeth. I don't do any of the other things that I used to do because I thoroughly enjoy doing one main thing, and that is implant surgical-based reconstruction. My typical patient, Randy, really falls into one of two categories. Either they have teeth that are in trouble and are pretty much going to be extracted at some point in time soon, or those who have no teeth. And each of those groups really is after tooth replacement, and that's what implants, of course, can do for them.
Now, at the top of the show, we said no more dentures, or nobody should be wearing a loose-fitting denture. You believe that?
Absolutely. In this day and age, I mean, we have the ability, the technology, to place implants into the jaws in such a way that we can anchor teeth. So with that said, my goodness, there's no reason that even as few as 2 implants into the bone of a lower jaw, for example, to allow the denture to snap in and snap out, in other words, to anchor the teeth, allow our patients to eat and chew better, something that simple makes all the difference, absolutely. And of course, we can then take that to a much greater degree in terms of multiple implants, as few as 4 or 5, which can then anchor 12 teeth. So thence same-day teeth. And we came up with that trademark some 9 years ago, and it applies to basically folks who can come in with bad teeth or no teeth, and in one visit, they leave with permanent teeth anchored by as few as 4 or 5 implants in either jaw.
So you teach this same-day teeth concept?
Yes, yes.
To the dentist?
I do. In fact, this particular protocol that's evolved over about 8-9 years now is the only one of its kind, the only course of its kind literally in the world, because it's so unique based on virtual workup, in other words, software. Different than conversion dentures, which is what the protocol is for most of us. We still do that. About 15% of our patients fall into that category. But the same-day teeth protocol is different because really what we're doing is working with software. So remote from our offices in Florida, the laboratory is actually out in Reno, Nevada, and we can be anywhere in the world and be online together, myself as a surgeon, the restorative dentist, wherever he or she is, and the lab at the same time, and we're able to literally treatment plan our patient in a virtual world.
So they could get teeth that same day. They could literally, on the day of the procedure, walk in with no teeth and walk out with teeth.
Absolutely.
That don't come in and out?
Exactly.
Is that right?
But
is that rare, or does that happen every once in a while?
We do it every week in our practice. And basically, it's such a neat protocol that it allows our patients in one visit to leave with permanent teeth. And it's an amazing process. I can't tell you the self-image ramifications from doing something like this. Our patients just marvel, male or female, they get emotional when we show them the mirror at the end of the procedure. And by the way, they're sleeping for the surgery. They really don't know anything that's going on. It's a very seamless protocol.
Like sedation, you're using sedation?
Intravenous sedation, yes. And it's such again, a seamless protocol that's followed from the time we see that patient right to the time of surgery, and at the end, we show them the mirror, and everybody gets emotional. They do,
wow. We
do, our staff. It's just a very neat feeling. So the feedback that we get like that just makes it all so much more worthwhile. In all of my years of doing implant dentistry, nothing compares with the gratification that I as a surgeon get from seeing these types of patients that have bad teeth or no teeth, and all of a sudden they've got a third set of teeth because God gave us primary teeth or baby teeth, right? He gave us permanent teeth, but now we have a third shot, and that's where implant dentistry comes in big time.
Now, respectfully, I have to ask you this.
Sure.
Because you are known all over the world. I mean, I was telling my team, I said, I guess if you're a specialist, everyone knows Dr. Michael Pikos. Does it cost more to go to somebody at the top of their game like you?
Ironically, you would think intuitively the answer would be yes, but it's no. And in fact, to some degree, it may be less because of the following reason. Our technology is so great now that who wouldn't want things to be done, quote unquote, really well
the first
one time? Yes, the first time.
We should mention Medicare, Medicaid does not cover dental implant dentistry. And even with the best dental insurance, from my understanding, it only covers a very small part of this. So what's the answer? What do you do?
Well, basically, that is reality, by the way, but the good news is that we offer financing. In fact, folks take advantage of that all the time.
So they are financing these procedures?
Oh, absolutely, sure. In fact, it's probably one of the best investments they can make because it's an investment in themselves. And unlike a car that's going to wear and be gone, this is something that's an investment for, well, the implants will outlive the patient, generally speaking. The teeth are like tires on a car. They're going to wear, they get to be replaced, but in the big scheme of things, that's not a big deal.
Now, where you are there a lot of people wearing dentures or headed to dentures?
Oh, absolutely. I mean, goodness, we could probably fill Raymond James Stadium and Tropicana Field back in Florida, where I'm at in Tampa Bay, with 10 times the capacity of people that are in that category, because literally nationwide, there are over almost 60 million people without one or both arches of teeth, meaning they're wearing a denture in one jaw or both jaws. Almost 60 million, 60. So absolutely, we have a lot of folks that are into that category, fit in that category.
Well, if dental implants are so good, getting your teeth back with dental implants, why aren't they all doing it? What's your take?
That's an interesting question. You would think with all the advertising that goes on, all the marketing, that most anybody would want to run in and get things done like yesterday. The reality is, at least 4, maybe 5 good reasons that the average patient that wears dentures doesn't come in. Number one, probably the most important one, is that these folks are in kind of a world of their own.
We're talking about denture wearers.
Denture wearers.
Okay.
Once they get their dentures, it's almost like a closed society for them. They feel in their mind they don't really need to come back and see a dentist again because they have no teeth. What's dentistry about? Teeth. I have no teeth, so I don't have to come in anymore. Well, because of that, they don't even know the options that we can offer them. So, Randy, the last thing they want to do is come and see an oral surgeon of all people, because listen, the teeth are out. Why do I need surgery? And what would I want to go to a general dentist, because I've got dentures now? So they don't even know their options, unfortunately. However, if they were able to come into the office, and of course we can explain what the options are with implants, etc. Now, number 2 reason, which kind of goes hand in hand with number 1, is that the fact that they are in this own little world, they've learned to what? Adapt, accommodate. The human body is an amazing entity in and of itself to do that. So what I mean by that is they, in their own mind, sometimes just rationalize so much that they feel with their dentures, they can't eat all the foods that you and I can. We take for granted we've got great teeth. So therefore, they're chewing foods that are, soft in nature, etc. In other words, they're limited, but in their own mind, that's reality, and therefore...
Doesn't have to be that way.
It's unfortunate, sure. So think about this, Randy. If you were a denture patient now, you would probably remember why it came down to that, meaning you can't possibly forget the 35 to 40 or more visits over a lifetime back and forth to the dentist, root canals, gum surgery, veneers, crowns, you name it, and inevitably things start falling apart. The last thing you want to do is go back to a dentist. So basically, why do it?
It's hard to get them back in.
It is hard. And of course, another good reason is cost. And unfortunately, a lot of our patients think that, you know, it takes an implant per tooth to replace everything that they have lost. And unfortunately, that's not true. Or I should say, fortunately, it's not true, because as few as 4 or even 5 implants can hold 12 teeth in either jaw permanently. So therefore, the cost many times surprises our patients, absolutely. Another big reason is fear, no question. We have a lot of phobics. And fear is what? The unknown. If you don't know something about something, you're going to be kind of concerned, human nature. And pain is a big one.
Seems very painful.
Absolutely. I'm sorry?
It seems very painful.
Well, you would think so, but the reality is placing implants, the effect of it is not so bad at all. It's really amazing how intuitively you would think that, but it's not true. It is not.
So the bone doesn't really have any feeling. So they
No, it's really the gum tissues that do, and teeth. When we're taking teeth out, yes, they're nerve endings, but the good news is when we do take a lot of teeth out and place the implants at one time, and the permanent teeth, by the way, the entire process, I'll tell you what, many of our patients will remark, and we see them typically a week later, they'll go, Dr. Pikos, wasn't so bad at all. You were right. I took pain pills for 2 days, and that's it. Like, really? Some will say not even 2 pills, and I went right to over-the-counter acetaminophen, pick something. Okay. So it's not so bad, not at all.
What about age? How old can you be to do this?
It's a great question, because so many of our patients, that's another deterrent. They come in more or less, or I should say they stay away because of a self-diagnosis situation, meaning in their own mind, they feel that they're too old. And I love to hear that, because what's too old? 50, 60, 80, pick a number. The reality is today, age is of no consequence.
What's your oldest patient?
Well, let me tell you a quick story.
Okay.
You won't believe this, but my oldest patient was 101 when I worked on her, but I didn't know that. This little 90-pound gal, ex-policewoman from Chicago, comes to see us from a nearby home that she had been in for a few years now. And the long and short of this, was frustrated she couldn't work with her dentures so well, she couldn't eat, and was frustrated. And how sad that is for so many of our patients. So the long and short of it is we placed just 2 implants in her lower jaw so that the new teeth could snap in and snap out. And because of that, wow, what a difference it made. Well, she comes in initially for the first visit back, which we see all of our patients back when we're working with dentists away from our office. And I'm remarking about, wow, you're happy with your teeth, let's get an x-ray and this and that. And boy, at your age, and as I said that, her caretaker from behind the chair was like this, like, and I'm thinking, what did I say wrong? So when we had her get up for the x-ray, I asked, did I say something like bad? Or
yeah.
Well, no, she said, Mrs. So-and-so is very sensitive about her age. In fact, she lied about her age on her birth certificate to us. She's 101, not 91, like I thought.
Wow.
So there I am placing implants in a 101-year-old patient, but guess what? She lived 4 more years. And she loved, from what they had told me at the home, because they notified us when she passed, that it changed her life so much that for those 4 years, it was so worth being able to eat and chew. Let's face it, Randy, as we get older, what's one of the few things left to enjoy in our life? Eating. And I sure love to eat. If that's taken away from us, are you kidding? Our entire lifestyle changes.
To eat, to chew, to smile. What do they like more? What they could eat, or the fact that they have good looking smile again?
You know, there's 2 great categories that you just touched on, you know, aesthetics and function. And there are some patients that come to us and, Doc, I just want to look better. I don't care about eating and chewing and all, I just want to look better. Okay. And then we have the category of patient that comes in and says, Doc, I want to eat and chew, you know, I'm miserable. I hate these dentures, you know, do something for me. Well, ironically, each of these groups ends up in the same basket when all is said and done, meaning the aesthetic-minded group is so ecstatic that they can eat and chew better, they didn't even realize that was an issue.
So they came in and just wanted a pretty smile.
That's it. And now they got both.
Now they get to eat. Okay.
Exactly. And the folks that are more functional driven are ecstatic because they look better now all of a sudden. So now we're looking at this self-image change, which is traumatic in many cases, many of our patients. And wow, it's just amazing to see all of a sudden new hairdos for the females, makeup you've never seen, new clothes. It's like a new life, a new lease on life.
And how soon can they eat after it's done?
Immediately. Immediately. Now, for 4 months to 5 months roughly, we're waiting for the implants to quote unquote fuse to the bone or integrate, as we term it more technically. And during that time frame, we really want our patients to...
Like soft foods?
Soft foods, which means eggs and pastas, soft meats. It doesn't mean just pureed foods, not at all. But after that 4th month or so now, they get a second set of teeth that actually look even better, which is hard to believe, than the first set of teeth.
Okay.
I mean, it's an amazing process.
So they can chew at that point, what?
Oh, at that point, they can eat and chew anything they want. In fact, so many of our patients are frustrated. They can't bite lettuce. They can't eat ribs. They can't eat corn on the cob. Well, guess what? When all is said and done, they can do all that. No, they can eat and chew any food that you eat and I eat.
So you can bite like a carrot with the front teeth.
Absolutely. Snap it right off. Not a big deal at all. Absolutely. The anchorage is so incredible for these teeth, and the materials that we now are able to use are so strong that in essence, there is no food they can't eat.
Now, look, I was telling you, I know denture wearers, a couple of them. They never complain. Are you saying there's no such thing as a happy denture wearer?
Well, you know, it's interesting that you even bring that up, because the life of a denture patient is very interesting. And I couldn't appreciate this in my early years, but as time went on, wow. You know, you take time to talk to your patient more, you listen, and that's the most important thing, is just listening. And what I've learned is amazing over the years now, and that is the following, that the life of a denture patient, think about this for a bit, they've got to glue in their teeth for the most part. Most of them, especially a lower denture, has to be glued in, adhesive. It's a multi-billion-dollar industry, denture adhesives. Okay. Now, how much fun is that, to glue in your teeth? You're drinking something warm and or hot, and all of a sudden that glue now gets not so good in terms of adhesiveness, so the teeth start to move. That's not so fun. But how about you're in a restaurant? Number one, you've got to look at that menu and pick very carefully what you can eat and not eat. And if you're with a group of people, which typically you're going to be, it's a little embarrassing in that sense. But now how about this? You're eating, and all of a sudden you've got to excuse yourself because the glue's not there anymore, and or you've got to, you got food under the denture, so you've got to kind of quietly sneak out into the restroom. Ouch. That's not so much fun. They tell you this stuff? Oh, sure. When you prompt enough, amazing. I've learned that. Ask them questions, and you'd be surprised the answers you get.
So when they get their teeth back, they're smiling.
Amazing.
Maybe they're the life of the party the way they used to be.
Amazing. The smile is such a big thing. Are you kidding? I mean, let's face it, 95% of our body is covered by clothing. 5% or so is here. And when we talk, where do we zero in on? The teeth. Absolutely makes a huge difference. The smile, and now the self-image changes. And my goodness, when we see the dramatic changes, it's truly outwardly amazing. As I mentioned, the hairdo changes, the clothes, makeup, etc. But more so, people just feeling better about themselves. I mean, good night. I've had patients that the spouses will remark and say, "Thank you for what you did for my husband or for my wife," because now I've got the spouse back that I had before. Retirement now makes all the sense. Before, I had this old grumpy guy sitting in the chair with the clicker, but now, oh my gosh, he's rejuvenated. He's a new man, and I feel like I'm married all over again. It's so neat because you changed his life. You transformed his life.
You know, we had a cup of tea together, green tea downstairs, and you were saying, Randy, or I'm paraphrasing, but I have my own teeth. I take for granted that there's so many people that are embarrassed of their teeth or embarrassed of their old denture.
Absolutely.
And so I guess your message is letting them know they have options.
Absolutely. In fact, right. You know, many times we feel pigeonholed and we get caught in our own little ruts, but the good news is we can make changes. And one of the best changes any patient can make, any person that has dentures in particular, wow. We can offer them a range of options from as few as 2 implants to snap-in teeth to 4 to 5 that give you the ability to have permanent teeth, 12 of them in each jaw. wow, what a difference.
Now, I've had people that come on this program that will say, but Randy, fixed teeth. That's what people want. Teeth that don't come in and out. And you're talking about snap in, snap out.
Well, no, absolutely. But here's the thing, you know, there's so many centers that offer only one option, and that is everybody gets a size 10 shoe, meaning one size fits all. What do I mean by that? I mean that everybody must get their teeth out and permanent teeth in. Well, you know what? That's really being insensitive to a number of our patients, because a lot of these teeth can be saved, and that's a great thing, because what God gave us is a good tooth. We can't replace with any dental implant that we have available today. Not even close.
Okay.
Not even close. So therefore, one option is to save some teeth and work around those teeth. We always give our patients that option. You know, one of the things that really frustrates me a lot, Randy, is that, you know, some of the centers that offer the option of, the only option, by the way, there is no real option, it's one thing, meaning permanent teeth for everybody that walks in the door. It's unfortunate for a lot of our patients, because
Why?
about 70% of these folks can't afford to have a full set of permanent teeth. So they're sent out the door to suffer with their dentures. You know, I have a problem with that. And that's why from day one, we've always offered options. Again, as few as 2 implants can snap teeth in and out.
So full RTD, snap in, snap out.
Absolutely. And guess what? We can graduate them, and in time, as they can afford it, we can then add a couple more implants and go to permanent teeth. In fact, I know your dad, from
That's
a
right.
story
I
you
told you
related
that.
to me some time back, started with just 2 implants.
He had a snap in, snap out,
Sure.
upper and lower. Now he's got permanent teeth on the upper and lower.
Perfect.
3 years later.
Exactly. But it doesn't mean everyone's going to graduate necessarily. They can stay with those 2 or 3 implants for their lifetime.
Okay, now you brought photos.
Yes.
And I hate to rush you, Dr. Pikos, but we're going to have to go over these quickly. And I know that you said it really changes their appearance, changes everything about them. Let's take a look.
Absolutely. This is Lucy. And you can see from that picture that a number of those teeth are really bad. And in fact, in her situation, really none of them could be saved to speak of. They were decayed and periodontally involved, a lot of gum problems, etc. So as you'll see in the after picture, what a dramatic change, because the characterization of the teeth, everything fits in the framework of her smile so well that you can just see in her eyes. I mean, she radiates, she glows in fact, the pre-op picture, we had to force that smile because she's very guarded, like many of our patients. They don't want to smile, they're embarrassed. But Lucy, what a dramatic change. And she had a lot of symmetry issues. It was a very big challenge for us.
So she can eat whatever she wants.
Anything she wants, yep. And what a great ambassador for our practice. She loves the procedures that we did, 2 jaws, upper and lower. And my goodness, to do this in a matter of, what, 4 to 5 hours maximum is amazing. It is. But more amazing is the dramatic self-image change for Lucy. Sure. And let me show you Ed. Ed came to us with no teeth. In fact, had dentures, but hadn't worn them for some 8 to 10 years, believe it or not.
Doesn't wear the dentures?
Yes, and many of our patients will do that. They gum it, so to speak. But look at what was done, and in his case, we were able to do it very conservatively. We didn't have to make any gum incisions. His surgery was done in less than 3 hours, completely. 2 jaws.
Full
upper
teeth,
and lower,
upper and lower.
Upper and lower. Look at his mustache, before and after. Start trimming it. His wife made comments unbelievable, like, I had an old man, I've got a new man. Amazing, amazing. And James, wow, what a great story. Look at the before and after now on him.
Not even the same guy.
Not even close. And Theodore, wow, World War II veteran, 97 years old today. At the time we worked on him, he was 76. And what we gave him in the lower jaw was a custom implant that at the time didn't allow for permanent teeth for the lower jaw, but snap in and snap out. And what a difference it made for him. My goodness. I didn't know this till just a few years ago when he came in for every 2 years I'm coming back just to check him. And I'm ready to leave the chair. He goes, Doc, 1 minute. So I backpedaled, sat down. What is it, Mr. Petransky? He goes, Doc, I'm so sorry I never told you this, but when you did my work, I was so depressed. He was 76. He said, my wife was beside herself. But when you finished my work, became a different person. And I am today, and it rejuvenated me so much, in that exact language is what he said, that I've been a new person all these years. And God has allowed me to live to now 97 years old.
Wow.
Yeah, amazing, amazing. And here's Deborah, who basically was headed for dentures, and the thought of it just absolutely made her so sick. And when she realized that she could have this same-day teeth protocol, boom, 2 jaws, upper and lower, same-day teeth, happy as a lark.
They don't come in and out?
Look at the smile.
They don't...
No, permanent. Are you kidding? No, absolutely not.
They look good. I got to admit, they look good.
Absolutely. Absolutely.
One more.
Sure, sure.
And we have about a minute left. I know you have 2 photos. We can probably show 2 more.
Sure, and here's Joanne. Wow. Joanne, educator, Board of Education, late 50s, hate my teeth. They're moving out, they're spreading. I've got gum disease. I'm told I'm going to lose all my teeth. The thought of dentures freaks me out, quote unquote. And bingo, upper and lower jaw, same day teeth again, permanent teeth, permanent provisional, as we call them, the first set of teeth, and then 4 months later, the final set. And look at her eyes. I mean,
very nice. Her
eyes say everything. She lost 15 pounds overnight and hasn't looked back. Transformed her life dramatically. And here's Kenny. Kenny just didn't smile. We had to force him to smile preoperatively. And lo and behold, in one morning, because he was headed for dentures as well. He's too young. The guy's in his 30s. Are you kidding? Dentures? Oh my goodness, no. And in one morning, again, permanent teeth, happy. An ambassador for our practice like you've never seen.
Good for
Smiling
you.
all the time.
Okay, so we're out of time. Now, we should mention, you have a training center in Tampa.
Yep.
Dentists, oral surgeons from all over the world you teach implant dentistry. And you said it doesn't cost more to go to an oral surgeon, to go to you. You have this team approach, everything done right there. You offer this snap in, snap out option. You offer financing. And final message though, somebody watching this, we're out of time. Okay. Final message, somebody watching this, maybe they're headed for dentures. Maybe they were told they didn't have enough bone to do this, because you said that you could always work with them. Mm-hmm. Or if they're wearing a denture now, but they don't want, the last thing they want to do is see you, as you said. What do you say to them about this process?
Well, Randy, it's really simple. You know, with the technology that we have today, there's no one we really can't help. And my advice would be, you know what, come to us, let our team work with you and show you how we can change your mouth, your smile, and one day give you permanent teeth. And most impressively, we're going to make you feel better about yourself because we're going to transform your life. Why not?
All right, good. It's always a pleasure to have you on the show, Dr. Pikos.
Thank you so much.
We'll have to have you back. Thanks again. And all of these they could find probably on your website, things like that.
Absolutely.
And I know you have 4 centers, so all centers have the same philosophy.
Yes.
Is that right?
Yes, and my colleagues, my surgical colleagues, basically we're all doing the same work. So we're all trained equally well and excited to help as many folks as we can.
Okay, good. Thanks again. You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.